About 10 years ago, mental illness was such an enigma. But today, we know that we are all infected or affected. Second week of May, being a Mental Health Awareness Week, it is important that we get to engage with the worries being reported about mental health issues so that we can get to know what is going on with our families and get to be able to understand what we can do when this hits home. Mental health is when our brain is functioning optimally, allowing us to engage with life in a healthy and productive way. This is when we are able to go to work, go to our businesses, go to school, and remain productive, and also be able to engage in relationships, be able to raise our families, do marriage in a healthy way, and also be able to cope with life-distressing issues. Some of the factors that contribute to lack of awareness or even treatment for mental illness is one, the illness being very subjective and very unique to the individual going through it. This is where we are not able to identify when someone says they are going through depression if we are not going through it and we've not had that experience. We are not able to understand what they are going through. Unlike physical illness, when you talk about pain, a headache, a stomachache, many people will identify with that. So if you say you have some physical pain, they may understand what you're saying. But if you're saying you're anxious, you're breathless, and you feel like you're dying, going through anxiety, other people will not understand what you're saying if they have not gone through it. So this makes it very difficult for people to admit or accept that they are sick and therefore they need help. And the people around them also will also tell them that is in your head. You're not sick, you're okay. The other factor is that people are looking for a face, in mental illness. They want to see certain things. We still don't comprehend that. We don't know what people look for. But I need to say that there is no face for mental illness. There is no way you look at a person and say this one is mentally ill, because it is happening to them and in their brain, and it is how they are feeling. That is why we say it's a subjective experience. So when someone is saying that they are feeling sick, or they are feeling depressed, or they are feeling sad, or they want to kill themselves, and we're looking at them and asking them, you have a job, you look beautiful, or you're handsome, you have money, what is your problem? The fact that most of the mental illness symptoms are very similar to normal responses or reactions to life, such as being sad, being low, or being helpless, or feeling disappointed, or being tired all the time, or lack of sleep, or too much sleep. And most of these are the common symptoms in mental illness. So when people are going through this, everybody will say, even me, I don't sleep well. Even me, I feel sad once in a while. But it is important we say, when these symptoms are because of life situations, when the situations change, the symptoms dissipate. When it is because of mental illness, you don't even need to be going through a life event. There may be nothing triggering your sadness. You're okay, you're going to work, you're making your money, your marriage is okay, but you're feeling sad and you're crying every day. You're feeling suicidal and you want to kill yourself, and you can't understand why you want to do that. And that is the point when you need to acknowledge to yourself first that you need help and you need to seek somebody to support you. The other factor is the stigma. People don't want to be seen going to see a psychologist or a psychiatrist. We think that if you are mentally sick, you're gone, you're done. People will stigmatize that. It is very interesting when I get people saying, I didn't even want to be seen coming to your office. And I understand that when they say that, because I know the labels that we give to mental illness that are very derogatory and very negative. So people don't want to be described as such. The other factor is the fear of what will happen if I take medication. Will it mess me up? Will the medication make my life worse? Or will I become a sort of a cabbage, as I hear people describing those effects? So it is not all the time that you're going to be affected severely, because the medication is supposed to be managing your symptoms. And if you have severe side effects, the doctors will also manage that. The psychologists will also give you tips as to how to manage your symptoms. And we always say in the treatment of mental illness. Taking medication is the lesser evil because you can manage the side effects and be able to live a normal life. Surprisingly today, people would rather look happy than feel happy. So they'll fake it, we'll mask it. We'll take a photo when we are smiling and post it on our social media. But deep down, we feel like we want to die. We will mask it with what we wear, what we have. And deep down, we know what is going on. It is good that we learn to live authentic lives. Be authentic and talk about what you're going through. Seek help if you know you're feeling low, but don't fake it with a smile, a plastic smile, but you know that is not how you're feeling. In assessment for mental illness, it requires a lot of honesty because there is a lot of self-reporting as the professional is doing an intake to get to know what's going on in your life. And many people are not open, especially initially when they go into therapy because of trust issues or even not wanting to be seen as sick. So they will come in and they think, if I say I'm going through all this, then I'll be given a diagnosis. So sometimes they're not very honest initially. And this also delays a healthy assessment and also a healthy treatment process for the individual. One of the best models in assessing and treating mental illnesses is biopsychosocial and spiritual model. Bio represents the physical factors. These are the genetic predisposition, where we say that it is good that we find whether there is mental illness, we find out whether there is mental illness in the family, and professionals always ask that question, whether there is mental illness in the family when they are assessing an individual. The other biofactor or physical factor is terminal illnesses. We know that conditions such as cancer, long-term illnesses, even normal conditions would contribute to mental illness or even exacerbate the symptoms of mental illness. In Kenya, we know, and the doctors are confirming this, that 1 in every 2 people with physical illnesses could be going through a mental health issue. And it is good that the government is now hiring psychologists in hospitals so that they can also reduce the burden of disease. As people are being treated for other physical illnesses such as HIV, cancer, that they're also being taken through psychological support so that they can get better faster and be able to remain productive in their lives. The other physical factor is the chemical imbalances that are known to contribute to mental illness, and therefore in the medical treatment, the medication given always supports and helps to rebalance the chemicals that may be affected depending on what the person is going through. Then the psychological emotional component of the model is about our thoughts, our core beliefs, and how we experience life and our emotional responses and reactions to life. And it is so important that we understand no 2 people, even when we have identical twins, will ever experience life the same way, because our DNA is different, our personalities are so different. So there are those personalities that will be more predisposed to some extent to maybe feeling more sad than others, or being more sensitive than others. And it is good that we understand how our personalities can contribute to mental illness, and also how we can support the people when we are taking them through psychological support to distort the cognitive thoughts that are affecting or contributing to their mental illness. When we talk about the social factors in the model, this is the relationships that people are in, the marriages, what is happening in those marriages, the separation and divorce contribute to a lot of issues to the children within those family settings. Abuse within families, the murders and the homicides that we have witnessed would also contribute to psychological emotional disturbances that can almost lead to mental illness in one way or another. Poverty is another factor. Issues in the community and in extended families can also contribute to mental illness. The spiritual and cultural factors can either contribute to better treatment of mental health issues, or even sabotage the treatment of mental health issues. This is, in sabotage, this is where people attribute the whole experience of a mental illness to demon possession, witchcraft, and therefore they don't go for professional help. In a supportive way, this is where people accept there is a mental illness and they seek professional help, even as they seek the support of authentic spiritual leaders and cultural leaders to support them in the treatment of mental illness. The treatment of a mental illness can be twofold, where we have psychiatrists giving medication or prescribing medication that manages the symptoms that the person is experiencing, or psychotherapy by a psychologist who helps the patient or the client to work with the mental processes that are maintaining the mental illness that they're having. And also important to say that not every mental illness is treated by medication. The psychologist should be able to assess and say some anxiety problems or depression problems can be treated through psychotherapy, but they also need to be authentic enough to acknowledge where the patient or the client needs medical support and be able to work collaboratively with a psychiatrist. And the psychiatrist as well is also able to work collaboratively with a psychologist, where they can see now the symptoms have dissipated and they can refer this patient to a psychologist to be supported with their thought processes, their belief systems, and their personal qualities that are contributing or maintaining the mental illness. It is good that we learn to go early for mental illness checkups, just like we do with physical illnesses, that we have annual checkups, or when we have pain or we have a physical problem, we quickly are able to talk about it and go seek help and go seek checkups, go for blood work. Today, it is also paramount that we all learn to seek mental health assessment. No doctor is going to force any medication on you, or a psychotherapist force any treatment on you. Please allow yourself, give yourself a treat by taking yourself to a professional just to be assessed and be allowed to continue living your life in a healthy way. And so that if there are any symptoms, they can be managed early enough. In most cases, people go in when it is too late, and therefore the treatment is very long term. In mental illness, prevention is always better than cure. And it is also good to add, there is no health without mental health. Thank you. Look out for our next episode.